Why most doctors fail at wealth creation despite high-income doctors are among the highest-earning professionals in India. Yet, many doctors reach their 50s and 60s with financial stress, an inadequate retirement corpus, and continued dependence on clinical work. Why does this happen? Today, I will explain why most doctors fail at wealth creation, and more importantly, how this can be corrected in a systematic manner. Welcome to Dr. Wealth India. This channel is dedicated to financial literacy, investing, and wealth creation exclusively for doctors and healthcare professionals. All discussions here follow low risk, evidence-based principles suitable for busy clinical lives. This content is strictly a bonds for educational purposes and does not provide any stock or investment advice. Doctors enjoy high professional income and high social respect. However, long-term financial security is often missing. This highlights a critical reality. Income is not equal to wealth. Wealth requires planning, discipline, and structured decision-making over time. Unique problem of doctors. The medical profession has a unique structural challenge. Doctors undergo long years of training, start earning late, and often postpone financial planning. As a result, doctors face a delayed earning curve compared to most other professions. Late start to earnings. The typical medical career path, MBBS, Maryland, DM, senior residency, means that meaningful income often begins only after 30 to 35 years of age. This leads to a shorter window for compounding and greater financial pressure later in life. Compounding matters. Compounding works best when time is available. Early investing allows lower risk and higher long-term returns. Late investing often forces higher risk-taking to compensate for lost time. Remember, time in the market is more important than timing the market. Overdependence on active income. Most doctors rely almost entirely on active income. If the doctor does not work, OPD stops, procedures stop, income stops. Without passive income or diversified assets, financial stability becomes fragile. Lack of financial education. Medical education trains us to diagnose, to treat, and to follow evidence-based protocols. However, we are not trained in asset allocation, inflation management, risk control, or tax efficiency. This gap leads to suboptimal financial decisions, despite high intelligence and discipline. Common financial mistakes. As a result, many doctors keep excessive money in savings accounts, overuse fixed deposits, treat insurance as an investment, or suddenly enter high-risk trading. These mistakes quietly but steadily erode long-term wealth. Lifestyle inflation. As income increases, lifestyle expenses rise automatically. Bigger homes, costlier cars, higher schooling expenses. Without intentional investing, expenses grow faster than assets, reducing long-term savings. What Dr. Schwad did differently. Doctors need a protocol-based financial approach, just like clinical medicine. Start investing early, follow asset allocation, prefer low-risk long-term strategies, separate investing from speculation, plan retirement independent of clinical practice. Key takeaway: wealth creation is not exciting. It should be boring, disciplined, and systematic. Wealth is built quietly over time, not emotionally or impulsively. Next video and call to action. In the next video, we will discuss how much a doctor should invest every month and where. If you are a doctor or healthcare professional seeking clear, calm financial guidance, subscribe to Dr. Wealth India, like this video, and share it with a colleague, because your financial health deserves the same attention as your patient's health. Final disclaimer: this content is strictly for educational purposes only. No stock recommendations are provided. Market investments involve risk,